From the beginning, the Canadian Armed Forces have been a part of the whole-of-government effort in our fight against COVID-19, where the women and men in uniform assisted in bringing Canadians home from China and Japan to CFB Trenton. And over the past weeks, I've been in contact with my international partners and colleagues to learn from their experiences. With that information and looking at the possible needs across Canada, I directed the Chief of Defence Staff to develop a plan that would allow us to support a domestic response to COVID-19 based around 3 priorities. To support the efforts to slow the spread of COVID-19, to provide support to vulnerable communities across Canada, to assist our provincial and territorial partners with logistics, including directly supporting municipalities if needed. And based on this guidance, the Chief of Defence Staff has developed a plan that will see the Canadian Armed Forces mobilizing up to 24,000 regular and reserve force members across the Canadian Armed Forces to support these efforts. The Canadian Army have readied up to 10 regular force units across Canada. These immediate reaction units are ready to support any request for assistance. They can play a critical role in providing humanitarian support and delivering supplies. They'll be ready to respond to support Canadians no matter where they live.
We've been preparing for a long time for this. We've got good plans in place, and we've got the troops sequestered, staying as healthy as possible so we can mount several thousand people at the same time if we need to. We are going to be able to respond either with specialist capabilities like medical, logistics, engineering, for a short duration event or for longer duration events, depending on what the need of the provinces is. We're also looking at significant responses in the event that communities start to suffer multiple events, including floods, forest fires, inside a COVID environment, where the armed forces will be able to put in place necessary support to critical infrastructure, logistics, as well as some medical support.